Thank you for tuning in. I'm here with Mr. Jerrid Douglas, who is an executive with a well-known banking industry, but in particular, he happens to be a member of the 100 Black Men. And in relationship to his involvement with community services, you're also the chairman of the Irvington Community Health Center.
Correct.
Now, the one thing that's really important about what we feel here in Irvington is healthcare. And the objective that the Irvington Community Health Center identifies with is being able to encourage community people, in particular those who have disparities in their lifestyles, to know how important the health center can be for them. The way in which you have structured it now is developing an outreach relationship. And on August the 8th, the Irvington Community Health Center will be having a health fair. The dynamics of it is based upon another theory, and that theory is how well the 100 Black Men has been actively involved in helping build, especially an awareness to Black men to get involved with doing things in their health. Why don't you share with us some of the aspects of where the encouragement comes from and why it's going to be critical in our community today?
Right. First, let me take a step back and talk about why these two organizations. I'm fortunate to play a significant leadership role in both of these organizations, and that's where my focus is. Both organizations play such a critical role, and being that I know them intimately and I know the work and the resources that they provide for our communities. The health center, particularly throughout Essex County, in Newark, in Irvington, and the 100 throughout the entire state of New Jersey. One, first and foremost, we're very aware of the issues that impact our community. We talk about it often. We have professionals who research this. They talk about this. We treat people, particularly from the health perspective, from the 100. We are often in dialogue as Black men about all the issues that impact our community. And so I'm sitting with two resources, two organizations that I've been involved in well over 10 years each, and thought it was time to really formalize and get both organizations who have overlapping missions, particularly centered around health and communities like Irvington, to focus their efforts, bring together their resources, because collaboration is key to progress going forward, and really do something that's going to be impactful for the community. And the 100, it's no secret that we've done health fairs in the past, and it's no secret that our health center, we've got a very active community outreach engagement staff, headed up by Carol. And so, the idea of it is now, rather than do those activities in silos, let's collaborate and do them together. Therefore, we can bring out the strengths of both resources, both networks. The infrastructure of both of those organizations working together should have a greater impact than each organization working independently. And that's all done in conjunction with the city, who's our other major partner. So you have the 100 Black Men, you have Newark Community Health Centers, and you have the city of Irvington, all partnering to focus on how do we get the community focused on health, to launch the start of our National Health Week, which was strategically just great timing to really galvanize our community. Because one of the issues our community faces is really, it's always information, know-how. A lot of times we don't get treated because we simply don't know what our issues are.
That's interesting that you would bring that kind of a point up, and why specifically it's very important and key that we create awareness opportunities. Those issues that you were really talking about are centered around the opportunity for access to health care. And as we know, that the large facility or the complex, or I think the acute care facility is what we would call it, are beginning to decline simply because of people not staying ill as long as they had in the past, and that most of the services that individuals tend to get are outpatient services. Is that the reason why this kind of a health initiative is really important?
It's important because finding what we found from the 100 perspective, what we found is we've had very successful health fairs and village family gatherings and screenings in the past. What we've learned is that the critical piece first was identifying that you have an issue, but then what next?
Mm-hmm.
You know, what about the follow-up care that's required once you've, you know, been diagnosed with, you know, having prostate cancer, which we've diagnosed many men over the years and have saved lives because that's been determined through direct participation at our village family gatherings in the past. But now, what now? That's the real question that impacts all of our community. What are we going to do? The health center, Irvington Community Health, which is a part of Newark Community Health Centers, that's why they're such a critical partner, because they have, through their infrastructure, through their design, they are set up, you know, and to see the uninsured, the underinsured, as well as patients who have insurance.
Mm-hmm.
So they're the perfect partner that we've identified to service our communities where the service is needed most. They've got, you know, a great slate of doctors. I happen to know the management team well,
Mm-hmm.
playing a hand in bringing the new management team in, and you know, the service that they give, our docs are dedicated to our communities. We hire them from our communities. They're highly trained. They really care, and that's the key difference in terms of healthcare delivery. There are many great physicians, but I find the difference is, you know, when you find physicians who really care about the people that they're serving, and
Mm-hmm.
the people look like them,
Mm-hmm.
it really creates a special relationship between patient and provider that encourages that can be nurtured.
And it's also inspiring because, you know, on many aspects, we feel that when individuals such as yourself aspire to certain levels of, you know, notoriety in the community or having a certain income, that they seem to separate themselves. But your insight, you know, being grown from the urban community and knowing things that are really pertinent and you can conditionally relate to it, gives you pretty much an advantage of knowing how to identify to those areas that need some change.
Yeah, I grew up around healthcare. You know, it's no secret that my mom has been a nurse all her life, and so I've watched her day in and day out take care of people, and you know, growing up, that can't help but rub off on you.
Mm-hmm.
You know, I know the importance of having a healthy, you know, physical body as well as mental and spiritual being. That's very important. The stresses of this day and age, you know, recession, turmoil, and all the other issues that impact people on a daily basis. If you don't have a strong foundation, then those stresses trigger other issues, which causes deterioration in your life, because it's not just you. It's really you, your family, your friends. It really impacts everyone that you touch. And this is why with the 100, this is a real issue, especially for black men. Because black men, we all know we have a habit of not getting treated, of really not taking the time to identify that we have issues.
Right.
And going to get them solved. So it's really historically been driven by our wives and our significant ladies in our
Mm-hmm.
lives beating us up until we go, okay, honey, fine, I will go to the doctor just to get you off my back. The reality is that we need to, take a more proactive approach in the welfare of ourselves and of our families, and we've got to lead. Yeah, we've got to lead.
We've got to lead is very clear, and one of the issues that is important about how this collaboration is going to be effective is that it's going to be able to provide information that most individuals are not aware of in relationship to their health, especially when it comes to African American men. And there's a confidence level that we seem to neglect in many aspects simply because we're not aware of information. The type of way in which this particular health fair is being put together is that there is going to be people talking about different health issues, people also speaking about these health issues when they're there. One of the things that really I felt very concerned about in regard to how it would be effective is that you will have a way in which individuals would be able to get involved with the treatment that's being provided at the healthcare facility. The delivery of that type of service, how has it really been significant in regard to the challenges that are needed in this community.
Yeah, I mean, that is extremely significant. One of the key things that makes this uniquely different is that oftentimes with other health fairs, you may have providers who may donate their time, and I applaud that. You know, any provider, any lab who's going to donate their time to treat and identify anyone with an issue, yeah, God bless them. I applaud that.